Welcome to a new episode of Watson Clinic Health Talk. I'm your host, Jamie Duvall, a content strategist in the Watson Clinic Marketing, Communications, and Media Relations Department. Well, it's that time again. With a new year comes new health goals, and Watson Clinic's family medicine and internal medicine specialists, otherwise known as primary care providers, are here to help you achieve those goals. On this episode, we welcome Dr. Jeremy Katzmann, a board-certified family medicine specialist at our Watson Clinic Highlands location at 2300 East County Road 540A in South Lakeland. Dr. Katzmann will discuss diet, exercise, preventive screenings, and additional building blocks to a healthier and more productive life. Appointments with Dr. Katzmann may be scheduled by calling 863-680-7190 or by visiting watsonclinic.com/Katzmann. That's Katzmann. Thank you for coming in here, Dr. Katzmann. Thank you for joining us today.
No, I appreciate it. Thank you for the opportunity.
So I'm wondering, do you notice an uptick in patients this time of year, the beginning of the year, who want to get a fresh start with their health goals?
Often we'll get individuals come in that are ready with the new year, they want a new start. And so they're coming often seeking advice and perhaps making resolutions and maybe out of optimism for the new year and coming off of the holidays and perhaps a time of excess, focusing on a time of sort of a reset, so to speak. Mm-hmm. And often they're trying to look at physical changes to make, dietary changes to make, or health goals that they haven't addressed before that they want to look into.
You mentioned diet. What else is there that they frequently ask you about?
The diet, trying to get a good game plan for physical activity, just from whether an exercise or just even increase in just day-to-day activities that'll help them. And then many will come in looking for a yearly physical, trying to see what they need to do for health maintenance or for screening procedures or screening tests.
Okay. So let's start with diet.
Sure.
That's a biggie. So tell me how you approach the conversation with a patient about their diet. You need to get a sense of what they're currently eating.
Yeah, often I think the longer I practice it, try to leave that open-ended, to try to ask a patient, where are they at with that, and trying to see where they are. Because some people come about it and they've done a lot of research, a lot of homework, and they feel fairly prepared and they've made many changes, or they believe they've made changes and it hasn't made the difference that they're looking for. Other people come in with many misconceptions because this is the way they've eaten, whether that's how they were raised, or perhaps that's the only things that's available to them. And so I try to leave that initial conversation, just sort of an open-ended conversation with some questions just to see, okay, where's their baseline? Sort of what's their understanding of nutrition? Sort of what are they doing now? What have they tried in the past? And perhaps what's been successful. If something worked for a while and stopped, okay, what happened? Did something else change metabolically for them or activity-wise?
What is the baseline to a healthy diet? What is suggested? What are the recommendations out there?
It's interesting. The recommendations, I think, frustrate a lot of patients because naturally America is very much of a fast-paced society. We want answers quickly and we want outcomes quickly. Naturally, with nutrition, many of the older things that have been established will get challenged, and there'll be different fad diets will come across, or especially with social media, well, this works for this person, why is it not working for me? But in general, especially when you look at the diet and activity, we have to create at least what I call a calorie deficit. We basically have to take in less than we're expending, and so for a lot of it is actually as we're having that initial conversation, I'll encourage people to use some of the devices and platforms we have now just to start tracking, what are you doing? And I'll try to tell them, say, listen, I'm not your spouse, I'm not your priest, but I need to know sort of what you've been doing. So I'll encourage them to use different apps, for example, like MyFitnessPal or Better Me, and some of these apps that are pretty sophisticated now that you don't have to be a dietitian or nutritionist to be able to put in that data. You could simply put, okay, I had 2 Chick-fil-A chicken strips, put that in there, and it'll tell you how many calories, how many grams of fat, how many grams of protein, how many grams of carbohydrates. So I'll ask patients to without editing, just try to be honest. Anything that goes in your mouth over 2 to 3 weeks, please put it in there. And then when we can sit down and go through that and just try to see what is your normal or what is your baseline.
Okay.
And then I've had many patients sort of have that epiphany that, wow, my normal's not normal. Because one thing that's built into those apps, it'll sort of have the daily recommended caloric goal. It'll have the daily recommended carbohydrates and protein goal. So, and serving size and portions. And so I've had many individuals, when they put it in, their version of a bowl of cereal was something much larger when they actually had to measure it out. Say, wow, 1 cup of cereal, that's not even a third of what I normally eat. And so a lot of times I think that realization of, okay, what I have been doing. And then once we have that data, then we can try to help come up with, okay, is it as simple as we just need to restrict how many calories they're taking in? Is it that, okay, their calorie intake is actually very reasonable and their dietary choices are reasonable? Maybe we need to pull the lever of increasing their activity, again, just to create enough of a deficit so that we should help them start losing some weight.
Okay. So, I mean, it really is kind of a calculation between your current weight, what your weight goal is, your BMI, how many calories you actually need to function in a day.
Well, yeah, and it'll vary for each person because everybody's body makeup's different, of course. And so like with the body mass index, we sort of joke around in our office. We want to rephrase it, instead of the body mass index is the BMI, is because measuring is important. Because there are individuals that they may have very dense muscle mass, they may have dense bones, and they may be above normal with a BMI, but for them and their frame, that may not be bad. But it is at least a good metric or guide just to say, okay, are we in calorie excess? Are we in calorie deficit? It just gives us a sense for them. But some of our recommendations will be tailored as well towards what are their goals, and what are their fitness goals, and where are they at stage of life? What are they able to do on the physical side? Because some people are limited because of different conditions or age or different things that have happened that maybe limit what they used to do for activity. But can we pivot and get them? Can we get them swimming? Can we get them walking? Can we get them at least even sitting in a chair, but using at least like a bike or that type of thing, or just I think the stationary pedal, just so we can try to get people increasing their activity a little bit.
Yeah, it is challenging because I think of advertising. I think on every corner there's a different restaurant of food that's not good for you. So I know a lot of people have frustrations like, well, what can I eat?
Right. Well, and it is hard because we're very, not everyone, of course, but in general, we have a very social, we're very social by nature. Food, especially many cultures, when you gather, food is going to be a big part of that gathering and a very important part of that gathering. And so I think some of it is finding out where are they at, because we do have those individuals that actually, when we track everything, we find out they actually don't eat enough. They're eating just the wrong things and perhaps at the wrong times, but it's not as if they're consuming too many calories. But all we have to do is, be anywhere in America currently. You just, whether a physician's lounge, hotel, airport, you go to a restaurant. I mean, the fitness of the average American can improve. And so there's many pieces to that to try to help them figure out what, and I think we really have to individualize it for that patient, because the advice I may have for you may be different for the advice that I had for the next patient, because we naturally they're unique individuals and unique makeup. Yeah.
Now we do have a team of dietitians and medical nutritionists. I don't know if you refer to them often when it comes to.
No, very helpful. And sadly, insurance constrains us a little bit with that. Naturally, if somebody's a newly diagnosed diabetic or someone on several medications, many plans will allow us to make that referral. At times, unfortunately, I've had patients that were sort of they were healthy, they metabolically they were okay, but they wanted to get healthier, and they wanted the advice of the dietitian. And at times in the past, we've dealt with it. The insurance actually looked at it as, why were you going to the dietitian? Because you're not diabetic. you don't have high cholesterol, you're not necessarily obese. And so every once in a while, unfortunately, we've had some
struggle with that.
Yeah. Even though the nutritionist, of course, would want to meet with that person and was more than willing to see them, but sometimes those constraints would stop some people.
Now, the older you get, what does that do to your metabolism age? Does it change your dietary needs, or?
I mean, majority of people, their metabolism will slow as they age, and especially as hormone levels change. Like for example, the just difference in the sexes, like men, especially, say men from 20 to 60, for example, if they either start eating right or exercise, they don't necessarily have to do both. Most of them, you can get the weight starting to come down. And a big part of that is men have more lean muscle mass. And so the lean muscle mass in the body will help you fight fat based on, if we can create that calorie deficit or increase our activity level. Women really need to do both. It's unfortunate. There's some women that can just diet and they'll control their weight. Some will just exercise, control their weight. Most women need to do both just because they have less lean muscle mass than men have. And then unfortunately, once hormonal changes come and menopausal changes, especially as the estrogen levels drop, it's much harder for women to then control their weight compared to when they were younger.
So exercise. Exercise is important to obviously keep strong and agile, and especially as we advance in age, and maybe it can remedy balance issues or that sort of thing, but also for weight loss. How much exercise should we be getting every day, every week?
No, it's a good question. I mean, in general, we need to get people more active, and so some of it's trying to figure out, okay, what's their baseline? How much are they? What are they doing? Because most of our jobs in sort of the modern world are maybe more mentally more of a mental job than a physical job. Even though there's many people that still have a physical job, but part of it's trying to see what are they doing. Because say you have someone that's working in an Amazon warehouse and they're walking 8 to 10 miles a day. You don't really need to have them walk anymore, but perhaps we need to work on strength training for them. And if we can get them on a good weightlifting regimen, that may do more for their health than having them jog or having them trying to walk more than they are. Conversely, if somebody's in an office, some of the best thing to do, get them a standing desk. Some people put that little treadmill underneath their desk as well, just to try to get the people to get those steps so that we can start getting them active. But several studies have looked at it, and some recommendations will say try to get at least 30 to 50 minutes of increased physical activity anywhere from 3 to 5 times a week. And some of that depends on where we're at with age, what are our fitness goals, and what are we trying to achieve for that individual.
What are some examples of everyday activities that can double as exercise?
Especially if we can get people walking. I think it's Florida, there's at least half the year we can walk, and we probably have little excuse not to. But it will get people say, oh, it's too hot, too cold. But naturally, they'll say that up north. But if Lake Hollinsworth is a perfect example. If you could get people walking around that 3-mile track, that's excellent.
Yeah, walking really is the simplest and most effective form of exercise.
Right. Yeah, walking, especially, and then also just lightweight training. A lot of it are things they can do at home and do on their own. Mm-hmm. But we can take advantage of our own body weight as our own gym, so to speak. And there's, and especially now online and with different social media apps. I mean, there's several sort of chair-focused fitness people can do at home that really they can just do with their own body and with just simple things that they have around the house.
Yeah. As a family medicine physician, a primary care physician, that's really, in my eyes, the most important specialist you can start with, because you're kind of a guide between all these other different specialists. Depending upon the patient's needs, you can offer referrals to cardiology or endocrinology, whatever kind of specialty you want to work in concert with. But you can also keep them up to date on their screenings. And I'm wanting to discuss some of those screenings that are necessary that people keep up with, and what are the screenings, and at what age should they receive them?
Some of it, of course, will be tailored based on perhaps the person and the person's family history. But in general, like metabolically, again, referring to what we're talking about just with generalized health and with fitness, cardiovascular disease is one of the most important things for us to try to screen early for some of the risk factors for that, but also for the condition in general. And so especially say age 25 to 35. We really should at least have touched base, hopefully at some point in time, where someone has a true primary care physician, where it's an internal medicine physician, family medicine physician, but someone that at least is following them metabolically. What I mean by that is, do we know their blood pressure? What's their baseline blood sugar? What's their cholesterol? And are they a smoker? How's their overall lifestyle? What's their fitness level? And then combining that with knowing their family history and tobacco history and all those different factors will then sometimes tailor a screening a little differently. We have some that are very sort of health focused, that they'll, even from their early 20s, they'll come to us once a year and they'll ask for blood work once a year. And for the most part, we're actually very agreeable to that and we'll do that. But for general screening, usually you've wanted at least touch base at some point in time before age 25 or at the latest 25 to 30 for sort of that initial exam and initial blood work, just to try to see where someone's numbers are. And for example, say at that age, cholesterol is mildly elevated, if blood sugar is mildly elevated, but they're not a smoker, there's not an early family history of heart disease, we're going to try to address that with lifestyle modifications and give them some parameters of, hey, let's work on this, and then retest. And that retesting can be as early as a year later. Sometimes we'll let somebody go several years. But again, nowadays I think we have more and more individuals that whether their focus or interest have increased where they want to know that data, and so they're willing to come in yearly and get the physical and get their lab work. Or some employers even do that as part of their wellness, their wellness plan, that want them to come in and have those parameters. And of course, if they have healthier workers, of course, that's going to just be good for the company.
I know there are screenings that everyone must undergo, or different genders must undergo, regardless of risk, and some need to do it at an earlier age because of risk. But like mammograms, colonoscopies.
Right. So for women, young women, if they come in for the yearly physical, it depends. I mean, naturally, we do a fair amount of women exams in family medicine and internal medicine, but many are tied into their obstetrician or gynecologist because maybe they're reproductive age and they're planning a family. And so we do need to just verify, okay, have they been receiving screening for cervical cancer? Naturally, many women of childbearing age are sort of in a routine where that's being done every 2 to 3 years, or increase depends on other risk factors. Mammograms, that's interesting. At times, different societies will come out and they'll say, okay, wait till age 50. But in general, most women and most consensus is we'll start screening at age 40. Yes. And with that, then that can be every 2 years or every year, just based a little bit specific on risk and on the person's family history. For both men and women, colon cancer screening, they've brought that down to age 45. It used to be at 50, but now they've brought that down to 45.
Are occurrences of colon cancer increasing nationwide? Is that?
Yeah, the incidence is higher. And actually, it's one of the cancers that if we actually were able to screen appropriately, it's one cancer that you really can change the incidence, because if you're screening appropriately, you're not seeing polyps, then that individual obviously is much safer. With women, we need to always think of the density of the bones, and so usually at age within 5 years of them going through menopause or age 60, whichever comes first, usually we'll try to get a baseline bone density test.
And that's the DEXA scan?
The DEXA scan.
Okay. And so that the bone density is important because low bone density would result in fractures or injury.
Right. It increases their fracture risk, and it's so important just to know at least where their baseline. Again, the medications have given us good options, both with oral medications or injectables if needed. But a big part of that is focusing on the activity. So going back to the walking, going back to light weightlifting, those things are so important to try to help a woman maintain that bone density.
So is there a way to strengthen bone density?
There is, especially with even outside of medications. If we just, again, sort of taking the assessment where someone is with their diet, are they taking inadequate calcium? Where's their vitamin D level? Do we need to replace that? We're surprised, even though we're in the sunshine state and many people are in the sun quite often, it's surprising how many patients are deficient in vitamin D. and then that'll increase the risk of bone loss.
Are there vitamins that you would recommend that are beneficial that everyone can take to maintain good health?
No, it's a great question. A big part of it is finding where they are with the diet, because many people they're doing very well with eating their fruits and vegetables, and they have a pretty broad diet that's going to get them most of the minerals and most of the vitamins that they would probably require. But I always suspect that all of us have holes in our diet somewhere. There's probably something that we're not doing quite right or all the time. And so most individuals don't really need a multivitamin daily. So I'll often tell people to take it perhaps twice a week, 3 times a week, because then we don't really run the risk of especially on the fat-soluble vitamins that can store or potentially be dangerous over time. Usually 2 to 3 times a week, we'll sort of avoid that. And then if it was the water-soluble that they didn't need, they would just eliminate that.
Oh, how long have you been practicing medicine?
This is my 24th year.
24 years. So in that time, are there treatment protocols that have come up that have kind of been game-changing that you've witnessed?
I think the focus on wellness is for sure increased during the 24 years I practiced, where it's much easier to get patients to get appropriate blood work, come in for their screening exams. And I think we have a generation of patients, say late 30s to early 50s, that are a little more forward focused on preventative health than maybe the generation right prior to that. But there has been some just some other augments that have helped. Like, for example, for colon cancer screening, now they have the Cologuard, where you can do a DNA test of the stool. So we had so many patients that perhaps they couldn't afford the copay or couldn't afford the cost of the colonoscopy, or there was fear or aversion to going through the prep or going through the procedure. Now, at least for low-risk individuals, we can do this exam, and at least gives them a 3-year window where if it's negative, that they don't have to do any other screening. Naturally, a colonoscopy is still the gold standard because you at least see everything. If you have a polyp, you can biopsy it. If it's negative, it gives somebody a 10-year window where they really don't have to worry about it. But some of these other screenings have come along that they have at least opened up some patients that weren't able to be screened before. Also, like if you have a family history of cardiovascular disease, the CT calcium score of the heart, or it's a CAT scan trying to pick up calcification in the coronary arteries, and if there's calcifications, then the thought is there's going to be atherosclerosis or some a plaque in the arteries. That's been very helpful because we'll have some family members or some patients that it's almost a tale of two families. So like on one side of the family, there's been significant vascular disease. The other side, there hasn't been. Perhaps their cholesterol is very high. They can't be on medication or haven't tolerated medication. And they're trying to see which side do I fit, or which mom's side or dad's side. And so those screenings have been helpful. There's advanced lipid metrics we can do for appropriately, but they can try to see, okay, if your cholesterol is high, looking at the different subunits and the breakdown of the cholesterol, are you at that much more of an increased risk? Or perhaps your numbers, they're elevated, but they're not necessarily the harmful ones. And so some of those things have been very helpful.
Yeah, that's encouraging that people are focusing more on prevention because, that's what's so invaluable about a primary care physician such as yourself is, we used to think, why would I go to the doctor? I'm not sick. But now they're taking proactive steps to ensure that they don't get sick. That's crucial.
No, it's crucial, and I think majority of people are reasonable with that, and it's where it's so important to get a relationship with your primary care physician, because then in our role, everybody's motivated differently, and of course everybody's genetic makeup and their lifestyle choices and where they are in their life is unique because it's a combination of all those factors, and so our recommendations, even though we have some general recommendations for most, we still will tailor it to that individual. And it's so important to have that relationship because perhaps, like in family medicine, at times we'll may have their parents as patients as well. And so knowing what mom and dad have walked through, it's going to impact how I deal with their son or daughter because it's going to perhaps say certain things I may not have to be as diligent with. Other things we may have to be very, very vigilant with.
Another important component to health is your sense of well-being. A lot of stress and worry and isolation out there. And I don't think that's helpful to our emotional or physical health. I mean, one impacts the other.
No, I agree, especially with health. Unfortunately, the mental health and someone's emotional health and even their spiritual health often you have been neglected or not thought of, because you get many people to think, okay, if I'm eating well and I'm in the gym, I should be fine. But they may not be dealing with their emotions well at all. And what I mean by that, like say whether anger or frustration or disappointment or and naturally there's going to be different things that happen in all of our lives, and part of it is, do they have that sort of emotional intelligence of how do I deal with those disappointments? How do I deal with pain? How do I deal with hurt? How do I deal with good things? I mean, but the emotions are very strong and powerful, and so it's interesting how we can see the emotions really impact someone's physical health. And it's a challenge. A lot of times there are conversations that have to be had over time to get a sense of where is someone, because maybe in the world's eyes they're successful because they get their promotions and they're busy and all the things they want to be. But we can sometimes the person ends up in the hospital, for example, God forbid, but with a heart attack, so to speak. But some of that actually was because of a series of many events, and it may be that their blood pressure was just right. Their cholesterol was just right. Their sugar was just right. They're doing all the right things, but they're in a high stress position. They didn't know how to deal with that emotional stress. They didn't know how to deal with some of the psychological and spiritual issues they perhaps were having, and then that can negatively impact their health.
Yeah, stress is a big one, isn't it?
Stress is a huge one.
Yeah. So, in general, how often should someone consult a primary care physician?
I think often young adults, say 20 to 30. Tell them, touch base with us every 2 to 3 years, just because, things change and naturally our body at age 20 to 30, there's a lot good can happen, but unfortunately a lot of bad can happen. By age 30, usually I'm encouraging most of my patients to try to come in yearly, and some still come every 2 years, especially if their fitness level and their activity level in labs are such that maybe that's reasonable. I think majority by the time they're 40 usually are coming at least yearly.
Okay. So what was the year that you started with the clinic?
I started in 2004.
2004. What made you choose the clinic?
The clinic, by reputation, but a big...
And by the clinic, I mean Watson Clinic. Just in case anyone out there is questioning that.
No, I was working in a small town in Wyoming where I trained in family medicine. In Colorado, they trained you to be a frontier physician. And what I mean by that, you go to the small town and you ran the emergency room, you delivered babies. I was doing C-sections, used to do colonoscopies, EGDs. You just sort of did everything the small town needed. And the next hospital is 80 miles away. So you sort of took care of that county, so to speak. And so when I first started that practice, it was an amazing practice, and you're doing so many different things. You're learning great things. But one of my good friend from medical school, he came to Watson. After he finished his residency, he started practicing OBGYN here in 2002. And so then other factors changed. All of a sudden, there was basically myself and one other individual taking care of everybody for that big radius. And so then every other night of that for several years became quite difficult, especially once our first daughter was born, and trying to figure out, okay, how are you going to balance work and life and all those things. And so he was having such a positive experience here at Watson Clinic, so we came and interviewed and then joined later that year.
Yeah.
It's been great, and Watson Clinic's been a great support because they give you a structure. Thank God they take care of everything behind the scenes that I don't necessarily know how to manage nor would want to manage, and so they allow us to just really practice medicine. But the nice thing is what I found in my 20 years here is the clinic isn't really sort of over you in terms of you need to do this or see so many patients or those different expectations. I mean, I think their focus is, of course, on quality and making sure that I'm doing my job and that you're practicing good medicine. But they sort of let you sort of move your practice the way you want, and that's been a great experience.
Thank you so much for coming in to talk to us about this today, Dr. Katzmann.
Thank you. I appreciate it.
To schedule an appointment with Dr. Katzmann or with any one of our more than 60 primary care physicians and providers, call 863-680-7190. You can also find the specialist of your choice and schedule an appointment online at watsonclinic.com. While you're there, you can hear previous episodes and subscribe to this podcast for free at watsonclinic.com/podcast. Thanks for listening.